All right, guys, if you own a private practice, physical therapy clinic, occupational therapy clinic, or speech language pathology clinic, and you want to see what Medicare pays private practice owners in 2025, I'm going to show you how to look it up right now. It doesn't matter what the state. I will show you for multiple states. The process is super simple. Let's go into Google. I'm going to tell you to go ahead and type in chooseptfirst.com, Medicare MAC by state. You're going to see this article. You're going to click on that link. This is my website. You're going to come down and all 50 states will be listed here with the associated MAC. So the MAC is the Medicare Administrative Contractor. They're basically the company that connects you to federal CMS. So if you take a look, let's say we go to Florida. Florida uses Spot as their MAC portal, but on the MAC website, First Coast, that is who the MAC is. We're going to come down on the side, fee schedules, find fee schedules. You're going to select Medicare Physician Fee Schedule. You're going to select the procedure code. I'm just going to use a minimum complexity PT evaluation. I'm going to use today, February 13th, 2025 as the date of service. And I'm just going to use 99 as the locale. Some states are big enough, they're divided into different sections. And so you can see, so non-facility is us. We are non-facility, we're private practice. $95.58 reimbursement or allowed amount for a Medicare participating provider, 97161. The non-par allowed amount is $91.01. And what you'll find is that the non-par allowed amount is 95% of the par allowed amount. The 104, which is listed as the non-facility limiting charge, LC is limiting charge, that represents 115% of the non-par allowed amount. So for those of you who are thinking, well, maybe I'll go non-par so that I can collect more, it's true, potentially you can collect more, but you go from 95 down to 91 as a non-par provider, then you have to elect not to accept assignment in order to be able to collect the limiting charge. The patient will not receive the full reimbursement up to the limiting charge. The patient's only going to receive reimbursement up to 80% of the non-par allowed amount. And then hopefully the supplemental or secondary insurance will pick up an additional amount. But most of the time, patients will have more out-of-pocket expense when you choose to be non-par and not accept assignment. You can collect more, but the patient's going to pay more. And in the end of the day, truthfully, most of the time, if you're collecting at point of service, the patient's using a credit card, so you're going to lose 2.5%, 3% right there to credit card fees. If you're not collecting at the time of service, you're going to have to track the patient down. That's mailing invoices, making phone calls. I have yet to see a situation where a provider chooses non-par, charges the limiting rate, and makes more profit than just going the par route. But let's take a look at a couple other common codes. 97110, Florida Medicare 2025. The allowed amount is $28.10. Remember, this does not reflect MPPR or sequestration reductions. For manual therapy, $26.55, and for therapeutic activity, $33.56. Let's say you're in my hometown. You're here in Ohio. So we'll scroll down, we'll get to Ohio, CGS. You'll click Part B. You'll go into, again, fee schedules. You'll click Medicare Physician Fee Schedule. You'll choose Ohio as the state. You'll choose the year. What's nice about Ohio is they let us put in a few codes, so I don't have to do one at a time. These are my most common codes, and you can see in Ohio, participating provider, reimbursements 93. It used to be 96 last year. Now it's 93 this year. Exercise is 27. Manual therapy is 26. Therapeutic activities 32. And gait training is $27. So those are the numbers, and if you want to really get depressed, you can come in here and you can scroll back like 2018. What was it back in 2018? it was $82, so significantly less for the evaluation. But then exercise was a little higher, manual therapy was a little higher, therapeutic activity was a little higher, so there's always a give and take. But this is how you look up your physician fee schedule. This is how you know what Medicare pays for physical therapy, occupational therapy, or speech language pathology in 2025.